Good morning, everyone. My study today is efficacy of 0.01% topical atropine in pediatric myopia as prospective study. The purpose of this study is to evaluate the efficacy of 0.01% atropine in pediatric population South India. It is a case series. Children between 5 to 16 years were enrolled in the first year and they were followed up for 2 years. So study duration of 3 years. It is conducted in Geetham Institute of Medical Sciences and Research. Written informed assent was taken. Actually, while explaining the assent, many of the kids' parents were not willing for the study. So only 8 people only we could enroll. And spherical equivalent of -1 diopter or more in either eye is included. Active myopia progression of at least spherical equivalent of -0.5 diopter over the last 12 months was included. An astigmatism of less than or equal to -1 diopter, distant vision corrected to 6/6 in both the eyes, and normal posterior segment were included. Exclusion criteria are allergy to atropine, history of any cardiac or respiratory diseases, ocular diseases like congenital abnormalities, amblyopia, astigmatism more than 1 diopter and high myopia, previous ocular surgeries, and lost for follow-up. Procedure, a complete ophthalmic examination was done. Every child was advised 0.01% low dose atropine to be instilled daily once in the night for both the eyes for a 2 years period and was reviewed every 6 months, and the parameters which were taken into consideration was spherical refractive equivalent, and the axial length and the pupil size. After 2 years, the 0.01% atropine installation was stopped and again reassessed for every 2 years. But now only the first 2 years period is finished. We have to still stop the drug and reassess during the washout period. And the plan is if the myopic progression recurs during this washout period, again we will start the 0.01% atropine eye drops. So the results are the age distribution was 2 years of 9 years age, 2 patients of 9 years age, 2 patients of 12 years age, 2 patients of 14 years, and 2 patients of 15 years. Gender distribution, 3 are males and 5 are females. And out of 16 eyes, 5 were myopic and other 11 were compound myopic astigmatism. And coming to the results, only one case showed increase in spherical equivalent refraction during this 2-year period. And in axial length, 2 cases showed increase in axial length progression. Whereas in the case 6, there was no increase in spherical refraction, but a 0.3 mm of increase in axial length progression was there. Pupil size, in 4 cases, definitely there was increase in the pupil size diameter. So discussion, this case series showed similar findings as ATOM study 2 and Indian atropine study, where it has demonstrated the effectiveness of 0.01% atropine eye drops in stabilizing the myopia progression. 7 out of 8 cases showed no change in spherical equivalent refraction, and only 1 case experienced an increase in spherical equivalent refraction. And axial length, 2 cases showed an increase in axial length, whereas other 6 did not show an increase in axial length. This shows the positive effect of atropine in stabilizing the axial length, as similar to the findings of ATOM study 1. Pupil diameter, 4 cases have experienced increase in pupil diameter. The effect of atropine on pupil dynamics is variable and it aligns with the observation with the other studies. Conclusion, the majority of cases exhibited no change in the spherical refraction equivalent and axial length for 2 years. It exhibits the potential benefit of 0.01% atropine in Indian eyes. Increase in pupil diameter is definitely a side effect of this low dose atropine, but patients did not experience any symptoms. Study limitations, it is a small sample size and an absence of control group, so impairs the generalizability of the findings. Larger control studies with extended follow-up periods are necessary. Thank you.
Are there any questions from the audience?
Is there any effect on the reading capacities of the children while using this atropine drops treatment? Is there any defect in ear vision happening?
Yes. studies have showed the side effect of atropine as blurring in the near vision, photophobia, itchy eyes. But in my study, they didn't complain any blurring in the near vision with 0.01% low dose atropine. Sir.
How was the axial length assessed in your study, madam?
A scan, sir, and we have repeated it 3 times. And the reading was taken.
Was it done by different people?
Yes, sir. The
or
optometrist, it is a blind procedure. I didn't
Yes.
do, sir. The optometrists have done.
Okay. The same person repeats it for 3 times?
Yes, sir. In my institute, the MSc optometry one professor is there.
Yes.
He has only handled these cases.
Okay, okay.
Yes. Pardon, sir?
No,
Ultrasound
ultrasound,
scan.
ultrasound only. Was it normal A scan or A scan biometry or immersion A scan biometry?
In few cases, we have repeated with B scan immersion thing, sir.
Yes.
And we have concluded the same axial length.
And you didn't encounter any patients with side effects?
No, sir. Fortunately, till now, no.
Yeah. Any questions from the audience?
Yeah, it is 0.3 mm. Maybe next third year, if we reassess, maybe there will be increase in spherical refraction in that case.
Thank you, madam.
Thank you so much.